Please start.
Okay, just okay. Okay, I'm starting. Okay.
Yes.
Good morning, everyone. Hello, I'm starting. Okay. Uh, Good afternoon, everyone. I welcome you all to the Nurses Empowerment Program on IVF Procedure Checklist. I would like to thank our IFS team, Sir Pankaj Sir, Shweta Ma'am, and our Secretary, Dr. Priya Ma'am, for this initiative of Nurses Empowerment Program. This initiative is aimed at strengthening our nursing team by standardizing practices, ensuring patient safety, and empowering each of you to play a key role in the IVF journey. Together, let's learn, share, and grow. Now, it is my honor to introduce our today's speaker, a very bright and dedicated nurse who has been an integral part of patient care. She is a BSc nursing graduate known for her commitment, compassion, and meticulous approach to clinical work. She has an experience of 6 years and currently working in Nova. Her strength lies not only in following protocols but also in guiding her colleagues with clarity and confidence. She has shown remarkable skill in handling IVF procedures, checklists, ensuring that every step is performed with accuracy and care. So, we are delighted to have you here and share your knowledge and practical insights with us today. Please join me in welcoming Ms. Jessica from Jalandhar Nova IVF, our speaker for this session. The stage is up. Now you can start, Sister Jessica.
Good evening, all the respected doctors and nurses. My name is Jessica from Jalandhar Center. Today, I will explain you about the preparation and pre-IVF checklist. Now, I will share the screen. Can you see my screen?
Yes,
Yes.
Jessica,
Just
we
put
can
it on
begin
slideshow.
slideshow.
Okay. Let's start. First of all, preparation of patient and consents verification. In this, we can what are the procedure held in the OT area, that is ovum pickup, embryo transfer, TISA testicular sperm extraction, laparoscopy procedure. In laparoscopic procedure, we can do the laparoscopic clipping and laparoscopic myomectomy also. In hysteroscopy, we can do the operative hysteroscopy and diagnostic hysteroscopy. The last one is the dilatation and curettage, that is the DNC. Next is let's discuss about the preparation and consents check for OPU, ET, and TISA. The first slide is prior instruction. First one is the inform patient to come to the center 1 hour prior to carry out the pre-operative preparation, in which we can ask the patient to come into the hospital 1 hour prior, because we can prepare the patient for the procedure and to avoid the unnecessary disturbance also. If sometime his patient is stuck in the traffic, then we are worry about our procedures. Next one is patient should come along with the spouse. Always tell the patient to come with the spouse or any relative also, because sometimes we are giving the GA to the patient. That time we need to spouse or any person who will take care. Next one is the admission procedure. In admission procedure, first of all, what we can do, the first thing we can do, prepare the patient unit. One day prior we know about our procedure is this, then we can prepare the unit one day prior also. In this preparation of unit, what we can do, neat and wrinkle free bed. It is done by the nurses and as well also done by the housekeeping staff. If the housekeeping staff is done bed making, then we have to coordinate with the housekeeping. Next one is check the cardiac monitor and working condition. The nurses should always check the cardiac monitor.
You are not audible.
I'm not audible, sir.
No,
Yeah, you
ma'am,
were
she
not
is
audible
clear.
for the
She is
last
clear.
30 seconds. Okay.
She is clear.
Continue.
I'm audible, ma'am.
Yes, now audible.
Yes, please.
Okay, the next point is the cardiac monitor. How we can check the cardiac monitor? We can put the pulse oximeter on the finger of us. Then we can check the cardiac monitor is working, switch on the cardiac monitor, and we can check that. Next one is the keep the flow meter filled with sterile water and label with date and time. This is the most important thing which nurses can do. Always use sterile water while you are filling the flow meter. We can never use the tap water because sometimes it is contaminated and it gives the infection to the patient. Always label with the date and time also. Next is the keep the cardiac table at the bedside of the patient to eat, to rest, etc. In other cases, we can use the cardiac table in the cardiac ICUs also, but we are having a IVF hospital. Then we can use the cardiac table as a to eat the food and to rest the patient for the rest of the patient. Next one is the keep the IV stand and footstool at the bedside. Always use IV stand at the bedside and footstool, because some patients are short, some patients are tall, or some patient having legs issue and anything else. Then we have to always place the footstool at the bedside of the patient. Next one is the keep the injection tray with all the essential items. Can somebody tell me what are the essential items in the injection tray? Hello?
Yes.
Can somebody
Please continue.
Okay. Keep the injection tray with all the essential items to start the IV cannula and administer the pre and post-operative medication as per doctor advice. In this case, we can essential items like a clean tray containing a kidney tray, syringes, 1 ml syringe, 2 ml syringe or 10 ml syringe, cotton swab, sterlium, gloves we can use while doing the injection to the patient, while giving the injection to the patient. This is the most important things. If we are giving the IV fluids to the patient, then we have to put IV fluids also in our tray. Next one is prepare the IPD file to start the care and documentation. After clearance of all the bills, the receptionist staff put the IPD file into the file of the IPD consents into the file. Then we have to prepare. We can give the care to the patient and write all the documentation. What are the medication we are doing? What we will do? What are the consents? They all are in the IPD file. Next one is the admission process. First of all, admission process, greet and receive the patient and attender with warm smile. According to the NOVA protocol, we can receive the patient with namaste and warm smile, because sometimes patient is anxious, patient is stressed out. So the duty of the staff nurse to receive the patient with warm or lovely smile. Next one is the orient the patient to the department and recovery room. In this, we can give orientation to the patient. This is your room or this is your bed, ma'am, and this is our ward. And in this, we can provide a very particular care to you for your comfort, with your full comfort. And next one is the check if the spouse has accompanied the patient. In this case, we can check the spouse is coming or not. If sometime consents are pending, then we need to spouse with the patient. And as we all know, the bigger supporter of the spouse is husband or wife. Next is the change the patient dress into the hospital dress. During the time of hospital dress, we can give the hospital dress to the patient. That time we can tell the patient to remove all the undergarments and put this dress. Next is the put the hair cap. Hair cap is mandatory because we are doing a sterile procedure. So the cap is mandatory in all the cases. While we are doing TISA, we are doing OPU or anything else, it is mandatory. Next one is the label and tie the patient identification band to identify the right patient and right procedure. This is our NOVA identification band, which I mentioned here. In this, we can write the name of the procedure, MRN number, age, consultant name, time of the procedure, and what are the procedure we can do. We can write. Why we can write this? Because we know sometimes patient is coming with same name, same procedure. So we identify the patient for the right procedure. So we can label and tie the identification band on the hand of the patient. Next is the complete the admission procedure in the register. As we all know, in IPD we are making a register for the patient. In that register we can write the serial number of the patient and MRN number of the patient, name of the patient and address with full diagnose, and who is doing the procedure, doctor name. This types of all the admission procedure should be filled by the staff nurse. Next one is the provide a psychological support to the patient while you are explain the procedure and care. Whenever we are giving the care to the patient, to provide a psychological support to the patient, don't worry, ma'am, is it okay? And don't take stress. We are doing well. We are doing best. These types of psychological support we can provide to the patient. Next one is confirm the billing and financial counseling is being completed. Whenever we are taking the patient into for the admission, then we have to check all the finances should be done or not. Next one is inform the consultant and anesthetist of the patient arrival in the unit. It is in this inform the consultant and anesthetist. We are inform the consultant and anesthetist 1 hour prior doing the procedure. Next one is the preoperative verification. In the preoperative verification, the first of all, check all the investigation reports depending on the procedure. We have to check all the investigation of the patients while we are doing the procedure. In OPU, we are checking the main one is the AMH. That is most important for the OPU. In ET, we can also check the AMH of the patient. If patient is PRO, yeah, PCOD, something else, we can check in the OPU type. And in TISA, we can check the LH of the patient, FSH of the patient, testicular scan of the patient. These all are investigation which are necessary while we are doing the any procedure. Next one is the check for 6-month valid serology or viral marker test reports. As we all know, we need to check the serology. Viral marker, it should be mandatory before 6-month test report. Next is the check the patient having any medical ailments like diabetes, hypertension, asthma, respiratory infection, cardiac issues can carry out the doctor's order. In medical ailments, if the patient having diabetic issue, then we know what are the medication we are giving to the patient according to the doctor's prescription. If the patient is diabetic, we never give the RL to the patient. If the patient is hypertensive, we never give the NS to the patient. If the patient having asthma or any respiratory infection, we can nebulize the patient. According to the situation, we can give the procedure, we can give the medication to the patient. Next is confirm for NPO status. How we can confirm the NPO status? Can somebody tell me? Hello? Can you hear me?
Yes, everyone.
Okay. Okay, I'll explain you. Confirm the NPO status by asking what was the patient last meal. When patient is telling us about the last meal, then we have to calculate our patient's procedure time. Then we can calculate the NPO status of the patient. Next one is the check the private area is clean, shape or clipping is done. If not, ensure to do it before shifting to the OT. If the patient, whenever we take the patient into the OT, before doing any procedure, we need the duty of the staff nurse to check the part preparation of the patient. If it is not, then we have to do ourselves also, or taking help of the housekeeping also. Next one is ensure to remove the undergarments. I already explained you. Next is the check the patient has nail paint applied on cosmetics, perfumes, any jewelry. If the patient wear any jewelry, then the duty of the nurse is to hand over to the attendant in front of the patient. Why we can tell the patient to remove your nail paint? It to maintain the sterility, to check the cyanosis. If the patient having a nail paint on the hand, then how we can check the cyanosis, and also we can check the and also it also affect the quality of oocytes. Next one is the pre-operative preparation. In pre-operative preparation is nothing but check all the consents taken, duty signed by concerned team and explain to the patient. This is the checklist. It's a pre-procedural checklist. In this, we can tick all the needs, all the record of the patient, and then we can in this all department can do this, fill this checklist. A receptionist also fill, CC can fill, financial counselor can fill. This is the common procedural checklist which can filled by every department. Next one is consents for anesthesia. Consents for anesthesia. In anesthesia consents, the nurse should cross-check the column should be filled, because during the time of auditing, the auditor can check all the columns are filled or not. In this, we can write the name of the patient, age, sex, MRN number, address, diagnose, operation title, patient what for come for us. These types of all the anesthesia report filled by the CC, but cross-checked by the staff nurse. In this, we can also take the what type of anesthesia we can given to the patient. Next one is the surgical sperm retrieval consents. In this, it is also related like this. In this, we can write the name of the patient, age, sex, MRN number, address, and procedural name, diagnose. These three types of TISA which we can do, micro TISA or PISA, MISA, or TISA. These three types of procedure which we can do in the during the time of surgical extraction, that is ticked by the CC. Next is the pre-operative assessment and checklist. In pre-operative assessment and checklist, it is cross-checked by the staff nurse. In this, this is the physician checklist. In this, physician can check the temperature of the patient, ECG of the patient, cardiovascular system of the patient, and central nervous system of the patient. These all types of system checked by the physician, and give advice and give medical of the patient, if the patient is medically fit for procedure. Next one is the
Jessica,
Yes,
Jessica, sorry. Can you just read out the pre-operative order here one by one so that the audience are clear?
yes, ma'am, I'll read.
Yeah.
Okay, first of all is nil by mouth for 6 hours. In this, I already told you about the how to check the nil by mouth for 6 hours. After that, shaving and enema. Shaving is important in every case. If we are doing any surgical procedure, TISA, OPU, ET, FET, IUI, it is important. Oh, okay. Next one is the enema. But enema we can do in the only in the surgical procedures like laparoscopic procedure, hysteroscopic procedure, laparoscopic myomectomy, and open myomectomy. In that cases, we can do the enema of the patient. The next one is remove contact lens. We ask the patient to remove your contact lens. Next is the remove nail paint. Next one is the inform consents for anesthesia and surgery taken. The next one is blood for grouping and cross match. While we are doing the laparoscopy procedure, we can check the blood group of the patient or cross match also. Record all the investigations of the patient and physician fitness. Anesthesia assessment also done by the anesthetist in this during the time of assessment of anesthesia. The anesthetist can do the PAC of the patient or any specific consent. If we are taking the any specific consents of the patient, then we can tick here. If the patient is skip any medication like diabetic medication or hypertensive medication, because we tell the patient to don't give any medication without any prescription, so that time we can write here or tick here. If the patient is thyroid, then we have to tell the patient to take Thyronome, how much she will take, then with the sip of water. The last one is if the patient is diabetic or patient having any issues, then we have to check the RBS of the patient during the time of admission. Is it clear to all? Hello?
Yes, clear, Jessica sister.
Okay, the next one is the preoperative medication. In preoperative medication, just a minute. We can give the antacid to the patient, antiemetic to the patient, or any antibiotic to the patient. While we are giving the antibiotic to the patient, we are always giving the test dose to the patient, that is 0.5 ml subcat. After 30 or 1 hour after, we can give the full dose of the patient and normal saline or IV fluids which are prescribed by the doctor. This is a medication order consents. In this, we can write the name of the patient and MRN number of the patient. In this, we can write the pre-operative medication and date of the medication, what medication we are giving, like injection Aciloc 2 ml IV, injection MSAT 2 ml IV. If we are giving the antibiotic, then we have to write the injection Tarazone S 1.5 gram 0.5 ml subcat ATD. Then after the full dose, after the 30 minutes, or whichever IV fluids we are giving, we can write here. Here we can write the frequency of the 1 BD, TDS, OD, STAT, what we can given the patient. Here we can write the in the morning, in the night, when we are giving the admission medication to the patient. Next one is the next is the nursing chart. It is always done by the nursing staff. In this, we can write the full name of the patient, like Mrs. Sunita, wife of Mr. Sunny. And after that, we can write the proper MRN of number of the patient, that is the medical record number, which is given by the hospital. Next is the we can write the date and time when we are doing the vital sign of the patient. In this, we can check the temperature of the patient. Normal temperature is 98.98 degree Fahrenheit, and pulse rate 72 to 100 beats per minute, and any BP 120/80 mm of Hg, or patient urine passed or not, self urine passed, and in ml we can write the urine output of the patient. In abdominal girth, if the patient having any bloating or OHS history, then we have to check the abdominal girth of the patient. Here the nurse can write the name and signature of the staff who is taking vital sign of the patient. Next one is this is the nursing chart, nursing notes. Here we can write the name of the patient and MRN of the patient. And firstly, we can write the receive the patient into the IPD area. After that, we can check the vital sign of the patient, and after that we can take the consents of the patient and pre-op medication given by the staff nurse as prescribed by the doctor. These all are things are filled by the staff nurses only. Next is why consents is important. Consents are important for the safety of the patient, doctor, and staff also. In this consents, we can tell the patient each and every risk, what happened during the time of surgery, or if something is happened like harmful is happened, then we take the consents of the patient. Next is the IV canalization protocol. First of all, we can check the prescription order of the patient. Then we start IV canalization and administer the IV fluids as per doctor order. Check the patency and flow. Label the IV cannula with date and time. This is the three types of This is the three pictures which I shows you. First of all, this is a sterlium which we can use for the IV cannulization. Here we can write the when we open the this bottle and what is the expiry date of this bottle. Next one is the IV bottle, IV fluids. In this we can write the name of the patient, date and time when we insert the fluid, when we given the fluid to the patient. This is the cannulization process which is done by the staff nurses and senior doctor also. Next is the test dose for antibiotic allergy. First of all, check the medication allergies through the test dose or skin test 0.5 ml intradermally and observe the redness, rashes, headache, vomiting, nausea and giddiness, increased pulse rate and respiration rate, etc. In this case, we can when we are giving the antibiotic to the patient, that time if patient having any redness, itching or these types of complication, then we have immediately informed to the doctor and report the doctor, and whatever medication or whatever treatment they will give us, then we are giving to the patient. Next one is the check the patient, check if the patient having any medical ailments like diabetes, hypertension, asthma, thyroid, respiratory disorder or any cardiac issue, then carry out the doctor order. Check the vital sign of the patient. In vital sign of the patient, the nurse should have to check the BP, temperature, pulse, respiration, SpO2 and record also. The next one is the RBS of the patient. If the patient is diabetic, then the duty of the nurse is to always check the RBS of the patient before doing any procedure. Next one is the blood pressure. If patient is hypertensive, then sometimes nurses never use the stethoscope, which are giving the wrong reading. So the duty of nurse, the duty of the nurse is to always check the blood pressure with the stethoscope and BP apparatus. Next one is the SpO2. If the patient is asthmatic, then we have to check the SpO2 of the patient. Next is the administer antacid. In antacid, we can give the patient to Aciloc injection. In antiemetic, we can give the NSAID to the patient, and in antibiotic, it is depend upon the hospital to hospital. But in our NOVA, we are giving the Terrazone or Spixin to the patient. They all are the medication. Why we are giving the all are the medication? To prevent the vomiting, aspiration, and infection of the patient to the patient. Next is antibiotic to be administered 1 hour before the procedure. Whenever we are giving the full dose to the patient, firstly we have to check the any reaction of the reaction of the medication. Then we have to give the antibiotic to the patient. Next, shift the patient to the OT by covering with bedspread or maintain personal privacy of the patient. In this case, whenever we are taking the patient for the procedure, that time we have to maintain the privacy of the patient and cover the patient with the bed sheet. Next is the hospital rule. Do not bring any valuable and ornaments with you. In special room, 2 relatives. In general ward, 1 female relatives will be allowed to stay with the patient. Third one is visiting hour 10 a.m. to 12 a.m. It is vary according to the hospital protocol. Next is do not bring children to the hospital, because we are know hospital acquired infection is occurring very gradually, so we can restrict the children into the hospital. Smoking and pan masala are prohibited in the hospital. Please avoid too many relatives at the time of operation. Is it clear to all? Hello.
Yes, ma'am.
Okay. The next one is this is the pre-preparational checklist which I make. First of all, unit preparation. In unit preparation, in OPU procedure, other surgical procedure, TISA and ET. These four types of procedure, what I can make this slide. In unit preparation, we can check all the unit preparation in all the procedures. Receiving and greeting the patient. We can receive and greet the patient in all the cases. So I have to tick it. The next one is the consents. The consents is taken by the CC in all the cases. In OPU, other surgical procedure, TISA and ET also. Next is change the dress. Before doing any procedure, we can tell the patient to change the dress in OPU or other procedures also. Next one is the pre-procedural checklist. In this, we can check the nil by mouth for 6 hours. And I'll already tell you how to check the 6-hour NP of the patient. It is mandatory in OPU, other surgical procedure like laparoscopy, myomectomy, hysteroscopy. And in TISA, if we do procedure under GA, then we need to check the NP of the patient. If we can do the procedure under local anesthesia, then patient take light breakfast. In ET, patient not required for the NPU. The next one is.
But if it is under general anesthesia ET, it is mandatory.
Yes, if it is in general anesthesia, it is mandatory. उसके बाद है part prepare. The nurse should cross check the patient part prepared or not in all the cases. The next one is anema. Anema, we can give anema only in the surgical procedure, not in OPU or TISA or ET. If the patient is required or we having the prescription order, then we will give the anema in other procedures also. Next one is remove contact lens in every cases. Next one is remove nail paint in every cases. Blood group should be mandatory check in every case. Record all the investigation. Before doing any procedure, we can cross check the all investigation while it is done or not. Next one is the check the identification band. In identification band, that is mandatory because I already tell you about the identification band, why is necessary for in every patient, because sometimes patient is coming with same name and same procedure. Next is the pre-op medication. Pre-op medication. In OPU, we require pre-op medication, and in surgical procedure also, or in TISA if required. If sometime whenever we are giving the local anesthesia to the patient, that time we are giving the test dose, LOX test dose to the patient also to check the allergic reaction. In ET, there is no pre-op medication. Sorry, it is by mistake, it's done by me. Next is the IV cannulization. In OPU, we can do the IV cannulization in surgical procedure also do, but in TISA or in ET, there is no need of any IV cannulization. Next one is the bladder status. In OPU, we can empty the bladder of the patient, or in surgical procedures like laparoscopy or myomectomy, we can catheterize the patient before the procedure at least 30 minutes or 1 hour prior. Next one is the for TISA, we can again empty the bladder of the patient, and for the ET, we can we want a full bladder of the patient to visualize the uterus of the patient, because we are doing the transabdominal scan. Next is the consents for OPD and IPD. In OPD, first of all, OPU. In OPD case paper, it is taken by the CC. In this consent, that is initial assessment of the patient, stimulation chart of the patient, form 6, form 9, form 12, or form I. As we know, the form 6 is nothing but it is a to provide us with the treatment services to the which are help to patient to bear a child. It is for that. The next one is the form 12. That is the consent for oocyte retrieval. The next one is form I. It is also consent for oocyte retrieval. The next one is the form 13. That is a freezing embryo transfer. In this we can इसमें क्या होता है कि जो हम कंसेंट्स लेते हैं वो अगर तो हम कुछ oocytes को प्रिजर्व करके रख रहे हैं उनके लिए है, और अगर हम स्पर्म को प्रिजर्वेशन करके रख रहे हैं फ्रीजिंग कंसेंट्स उसके लिए है. और नेक्स्ट इज द फॉर्म 9 फॉर द एम्ब्रियो फ्रीजिंग के लिए हम लेते हैं. और लास्ट वन इज द स्टिमुलेशन चार्ट. इन स्टिमुलेशन चार्ट we can write the date of stimulation, when we started the stimulation, AMH of the patient, what type of drug we are giving to the patient, how many eggs we have on the day of 5th day, 7th day, or 9th day. The stimulation chart should be maintained by the CC. Next one is the OPU. In OPU, first of all, admission consent. In this, we can take the admission consents of the patient. Patient is admitted for what procedure? That is the admission consent. Next is the consent for investigation, in which we can cross-check all the investigations of the patient, and consent for OPU. In OPU consent, we can check all the columns are filled or not, doctor signature is there or not, patient signature is there or not, age and time of the procedure is written by the nurse or not. These all are the things we can check into the consent for OPU. Next one is pre-operative assessment. Yeah, I already told you about the pre-operative assessment. Next one is the anesthesia record. In anesthesia record, the anesthetist will do the TAC of the patient before doing any procedure. Next is the operative note. In operative note, we can write the how many eggs we have in right ovary or in left ovary. We can write the total number of eggs in operative notes, and plus indication of the procedure. Next is the medication and administration. In medication and administration, we can write all the medication and what time we are giving medication to the patient. We can write all things. Check in safety checklist. We have to check the any previous surgery of the patient, or if we send any biopsy of the patient, then we have to write in safety checklist. The next one is the ET or FET procedure. In ET or FET procedure, we have to check the endometrium. We have to check the endomet of the patient. This is the monitor chart which is filled by the CC. Next is the consent for FET, OD, self, and DS. In this consents, we can tick what type of FET we will do. Is it self, is it DS, or is it OD? The next one is the admission consent as same, and form I, that is I already told you about. This is the freezing embryos transfer. In this consent, we can write the how many we can transfer into the patient. Next is the consents for embryo transfer. Embryo transfer note and medication chart, nursing chart which is filled by the nursing staff, and nursing notes according to the situation. What time patient is coming for coming, and what time she will discharge. Next is the endoscopy procedure. In endoscopy procedure, we have one booklet. In this booklet, we having a initial assessment form, In initial assessment form, we can write the past history of the patient, present history of the patient, ops history of the patient, examination of the patient, pre-op examination of the patient. Next is the pre-operative assessment, is nothing but it is a nirpar orally record all the investigation, all that. Next one is the anesthesia record, same as operative note, same as safety checklist, it is also same. Next is the regular assessment and treatment. If we are doing the endoscopy procedure, like patient is admitted for the myomectomy or patient is admitted for the laparoscopy procedure, then we write the daily basis note or treatment note by the CC. And after that, according to the prescription, the staff nurse will give the medication to the patient. Next is the medication order and administration, nursing chart, discharge and MRD checklist. Discharge and MRD checklist, in this we can check all the bills are clear, biopsy sent, discharge card is made, indoor case sheet done, anesthesia record done, PAC done, everything we can tick into the MRD checklist, and after that we can do the pagination also. The last one is the surgical extraction of sperm. In surgical extraction of sperm, we can fill the admission slip. In admission slip, we can write the name of the patient, address, age, and sex of the patient, procedure, and last at the bottom of the consents, we can write the patient name and time of admission and date of admission. Next one is the consent for admission. Is it same? Initial assessment, I already told you about this. Next one is the physical and systematic examination. It is done by the urologist. In this case, the urologist can check the testicular size of the patients and check the LH, FSH, and all the investigations of the patients. Then next is the Form H. Form H is nothing but in this we can check the what type of procedure we can do. We are giving the patient like microarray, sperm extraction, or TISA, PISA. What type of procedure we can given to the patient. Next one is the consent for anesthesia. I already told you about if we are doing the procedure under the GA, then we need to this type of consent for anesthesia. If we don't need, then we don't need. Then is the surgical sperm retrieval consents. This is the consents in which we can write the मतलब इसमें क्या होता है कि हम पेशेंट का चेक करते हैं कि हमें पेशेंट को कैसे लेना है, और अगर हम उसी के स्पर्म लेते हैं तो उसमें से कितने निकलते हैं, अगर नहीं निकलते हैं तो हमने पेशेंट को कैसे मतलब आगे तक लेके जाना है, अगर हमने हाफ डीएस लगाने हैं या हाफ सेल्फ लगाने हैं या पूरे ही डोनर स्पर्म पे जाना है. दिस इज द कंसेंट फॉर दैट. नेक्स्ट इज द क्विज कंपटीशन. Now,
so this is Shaila. Dr. Payal, can I speak? Can I take it further for 5 minutes?
Yes, Sister Shaila,
Yeah.
you can do.
Okay, Jessica, thank you so much for your wonderful presentations. Can you just close the slide? Yeah. So thank you all for your patient listening. So as nurses, I would like to just give you 3 instructions. Pre-operative preparations is very, very important, because from there it is very important. That's the first step for any procedures to take forward. Second is, as she told, consents. So generally in NOVA, the clinical coordinators take the consent, they explain the consents, take the consent signatures. But what is the nurse's role? They have to cross-check and verify whether all the signatures have been signed. All the consents have been completed duly with names, age, sex, all that, whatever Jessica has told you. So that has to be completed. Third thing is why consents are taken, because it's a mutual agreement of the patient to undergo the procedure. They're telling, yes, I will undergo the procedure. And it is for the legality, because we know fertility is based on our legal issues. Anything goes wrong, patient might claim. Okay, so that is very important. And thirdly, patient is being explained about the high risk factors. Okay, by anesthetist, what are the risk factors post procedure or during procedure. So we are trying to prepare the patient to um, understand all the risk factors, so that he or she is prepared well in hand, so that they are not supposed to raise the question if something happens post procedure, if concerns are taken. So I request all the nurses, see, we can tell the doctors that the consents are not being signed. Can you please sign the consent before we could shift the patient to OT? There is nothing wrong. But fortunately, if the doctors are very, very busy, I know OPD doctors will be very busy and there is no time for them sometimes to sign it. So it is your duty to get it signed before you shift the patient to OT. It's not later after the procedure. That's a wrong practice. Whatever it is, that is why we have enough time. We are calling the patient 1 hour before, so that all the consent signatures are signed duly before we are shifting the patient. Is it clear to all of you?
Yes, ma'am.
Yes, that's it from our end. And now over to Dr. Payal.
Are we having any quiz questions, Nona, this time?
I think, Jessica, if you have anything, you can ask them. Whatever you have taught, just ask them 3 questions. Let them answer.
Tell me about the essential items for the injection tray. In injection tray, what are the essential items while we are giving the medication to the patients?
You can write in the chat box also.
Okay, I want someone to just quickly tell me what is Form I, Form H, and Form 6. Kritika, you want to answer? Hardeep also can contribute. Anyone? I think they have gone left, I think, Dr. Payal.
Yes, I think so.
Okay, fine. Yeah.
Okay, I conclude now. Fine.
Yeah.
Okay, on behalf of the organizing team, I extend my heartfelt gratitude to all of you for making this Nurses Empowerment Program a meaningful and successful event this time. And special thanks to our respected speaker, Ms. Jessica, for her insightful session. बहुत ही अच्छा था Jessica, बहुत डिटेल में था, very good. तुमने सब कुछ include किया है, every consent, every checklist, everything was included. It was a detailed presentation, very nice presentation. आई होप्स जितने लोगों ने भी जितने भी नर्सेज ने सुना होगा दे मस्ट हैव उनको बहुत उससे नॉलेज वो होगा, जिसको कुछ कंफ्यूजन होंगे वो भी क्लियर हुए होंगे. एंड आई एम वेरी थैंकफुल टू यू. वेरी गुड प्रेजेंटेशन.
Thank you so much.
थैंक यू एवरीवन.
Thanks, doctor, for giving such a good opportunity for nurses here. This is a great platform.
Thank you Shaila sister, all under your guidance. I'm very grateful to you कि आपने जैसिका को इतना अच्छा गाइड किया है. Thank you so much.
So much. You're always welcome.
Thank you, ma'am.
Sorry, that was my kid. Thank you.